What makes a hospital a level 1 trauma center, and what does that actually mean? It depends on the services that they can provide to the community and the various different specialties that may be available for trauma patients. A level 1 trauma center is the top of the line, so it has the ability of providing trauma care in any specialty across the board. No matter what the injury, the hospital has the ability to care for that patient. There are only 216 level 1 trauma centers in the United States and 5 in the state of Georgia, and I take call at one of those hospitals. The data shows that patients that are treated at trauma centers have better outcomes. Here's the breakdown between a level 1, a level 2, and a level 3 trauma center. The biggest difference is that level 1 trauma centers have in-house general surgeons that can respond to trauma patients within just a few minutes. Specialties like neurosurgery are available to come in, and there's a certain time frame that they have to respond to a trauma. In other words, I don't have to physically be in-house for trauma call. So that means specialties like mine, there are no rules that we have to work a certain number of hours. For a lot of subspecialties like mine, where there's not a lot of us available, we do take call for long periods of time, and that's not uncommon. I take care of any neurosurgical emergency that comes through our door, and I have a response time of within 30 minutes, although if there is an emergency, I am here faster than that. There are some weekends where I don't get called very much, and there are some weekends that seemingly that I don't physically leave the hospital. We can talk about work hour regulations all you want, but in specialties like mine where there's not a lot of us around, there's no other alternative. A lot of facilities out there like mine where I don't have any residents, so on call is just me and one of my PAs. That means I take call for long durations of time, and I am responsible for any neurosurgery patient that is physically in the hospital and needs care, as well as any patient that comes through the emergency department that needs neurosurgery care, and any of the surrounding hospitals that are within our system. I have to answer calls from nurses on the floor about any patient, emergency room calls, inpatient consults from anybody in the hospital, which basically means I have to have my phone on me at all times and be immediately responsive to all of these questions. When I'm on call, I can't really plan for anything else. A lot of people outside of medicine, that may seem crazy, but for people within healthcare, that's actually very common. Work hour regulations are applicable to residents that are in training, but once you graduate, there's not really any type of standardized work hour regulations for physicians. Do you think that should change? If you think the answer is yes, where are you going to find this abundance of doctors that are going to be available to pick up the slack? The reality is, there's not enough of us to be able to do that.